Patients using crutches who are non-weight bearing begin in the same position used for determining crutch fit. However, the involved lower extremity is not on the floor. Generally, most patients hold the involved extremity in front when the knee cannot be flexed and behind when it can be flexed. The therapist is positioned in stride behind and to one side of the patient. The therapist holds the gait belt and the patient's shoulder. To ambulate, both crutches and the involved lower extremity are advanced simultaneously and the same amount. Meanwhile, the therapist moves his right or outside foot forward either at the same time or immediately after the crutches are advanced. Using her upper extremities to support her body weight, the patient advances her uninvolved lower extremity beyond the crutches. Initially, the patient may step to her involved lower extremity rather than step through. Stepping through is the normal gait pattern, and the therapist should encourage it. Again, the therapist advances his left or inside foot as the patient moves her uninvolved lower extremity. This sequence is repeated. Patients on crutches using a three-point gait pattern with partial to full weight-bearing capability start with their feet side by side in the same position used for determining crutch fit. The physical therapist must be positioned in stride behind and to one side of the patient. The therapist grasps the patient's gait belt and shoulder. To ambulate, both crutches are advanced at the same time and the same amount. The therapist advances his right or outside foot either at the same time or immediately after. The patient advances her involved lower extremity so the toes are even with the crutch tips. As she improves, the patient may move the crutches and involved lower extremity at the same time, resulting in a faster pace. Using her upper extremities to support her body weight, the patient advances her uninvolved lower extremity beyond the crutches. At first, the patient may step to the involved lower extremity rather than stepping through. The therapist should advance his left or inside foot as the patient moves her uninvolved lower extremity. Ambulating using a four-point gait pattern begins with the therapist positioned in stride behind and to one side of the patient. Again, the therapist grasps the gait belt and shoulder of the patient. In the starting position, the patient stands with the crutches in the same position used for determining crutch fit. The patient's feet are side by side. To move forward, the patient advances one crutch. The right crutch is advanced first. Then the therapist advances his right or outside foot. The patient advances the opposite lower extremity to a point even with the tip of the right crutch. She shifts her weight to the right crutch and left lower extremity. Then she moves her left crutch beyond the right one. The patient advances her right lower extremity to a point even with the tip of her left crutch, while the therapist advances his left or inside foot. The patient shifts her weight to her left crutch and right lower extremity. This pattern is repeated.